welcome to Laird Wellness Live.
Good evening.
Good evening. Hey, last week we had a bit of a glitch, so we had to tape it after we tried to get on desperately many times, but we managed to get it on. Hope you were able to see the program and hope you enjoyed it. This time we are live. Everything appears to be working. We had like an internet glitch or something. I don't know what it was, but anyhow, so this week we wanted to tell you about how to read your own blood test, and we are using some parameters that we have learned from Dr. Tom Lewis, who developed the blood test that we use for our Biologic Blueprint program. Very, very cool stuff. He has 55 markers.
55 is the signature panel.
Yep. Okay. 55 markers, and then we also, as part of our Biologic Blueprint program, we are also throwing in the COVID markers. So there are 10 more markers that tell you your risk of blood clotting and this kind of thing, and complications or potential complications, whether you get the jab or have had the jab, or you're just curious of, gee, if this thing comes my way, what am I in for?
Right.
So that's kind of a neat thing to have in there as well, and it's really helped some folks plan for what they can't see. So it's really good information to have. So what we're going to do is show you some interesting results from a couple of folks that we've had. And of course, we're not going to reveal the names or anything, but we show you how they've improved and what their numbers mean, and also just how to read your own blood test. And what we do when we look at your blood test, and we look at certain parameters plus other certain parameters and what that equals.
Right.
So it's these little calculations we do that, well, if this is up and that's down, that means this. And so it's really neat to see that kind of stuff, because you can tell things you would not normally be able to tell. Like, well, if this is up and that's down, that means that your body is clotting normally. And if these things are up and those things are down, well, that means that a spike protein is at work. So neat stuff you would not be able to tell just on your own. So we wanted to go through a few of these things and tell you about them. The algorithm that we use for this blood test. Now, it's not just the blood test. I mean, you can get these blood tests done through any doctor, but just every doctor is not going to tell you what they mean. And because they don't do the same calculations.
Right, and not every doctor is going to do this much of a deep dive.
That's especially
some of these biomarkers, no doctor will do.
Right.
Yeah.
Yeah, and it's strange that they don't. So anyway, so we do these through Dr. Lewis. And the algorithm that he has created for this. Now, Dr. Lewis is a super smart guy. He's from MIT. He works with the Harvard School of Public Health. So, those are some pretty big names. So he really knows what he's doing. He calls himself a medical scientist. He's Dr. Lewis. He's not an MD, but he is a PhD. And we do have an MD behind him, Dr. Michael Carter, that we work with as well. So we're all kind of a big team. We got an ND, me, we got health coach Jody, we got Dr. Lewis, yay, and we got Dr. Carter as well. So you got a whole team of really different perspectives working for you when we do our Laird Wellness Biologic Blueprint program, which we're going to get into a little bit later. But anyway, so this algorithm that Dr. Lewis created is so specialized that he has actually drawn a patent on it.
Yes.
So yeah, I mean, that's how specialized. It's really cool, and you can take advantage of this thing. So anyway, so there's 55 biomarkers, which means 55 things they test your blood for, and it ends up taking about 7 little vials of blood.
Yeah.
So you're sitting there for a little bit. Not quite as long as giving a donation of blood, but they're taking quite a bit because we're testing a lot of stuff.
I've had it done twice now, and it literally takes about 3 minutes.
Yeah, exactly.
And I've
had doesn't take long.
The 7 vials, and not a big deal at all.
No, it seems like a lot. People say 7 vials. How much is that? Well, it's 7 little pencils of blood. I mean, really, it's not that much. So anyway, we wanted to show you a couple of people who have really improved with this program. The one we're going to feature is a woman who had suffered from cancer.
Right.
And she was getting over cancer, and she gained some weight, and her health just went downhill because she did some conventional cancer therapy. And she said, you know what, I want to change things up. And boy, did she change things up.
Yeah, she's doing great.
We're really proud of her. And so there's a couple other people that did really well as well. And you know why they did so well? Because they stuck with it. Right. That's what it is. It's like, when people say, well, I tried this and I tried that. You can't do that. You can't just try something and expect it to work. You got to see it through. And if you see it through, it will work. There are many ways to heal. I've seen lots of people reverse cancer and diabetes and heart disease through a vegan diet. I've seen lots of people do the same thing through a ketogenic diet. So whatever whatever kind of food program we need to put you on, what kind of diet and exercise, what kind of a lifestyle you live, we will match that up to you specifically. It's not one size fits all. We do the teachings individually. We give some general information that you do need to know, that everybody needs to know, and we have some videos for you as well. So we do all that through the Biologic Blueprint program. But anyway, so this one lady went through it, and like I said, she had cancer.
Yeah.
And she followed it to the T. She went for her walks in the morning when it was pitch black. She brought her flashlight, and she did her walking for the recommended time that we recommended that she do it for. And she was out there every day.
And not only that, she's probably, 10 years older than I am?
She is. Yeah, she's about 60.
And so she's now running 1.5 miles a day.
Yeah.
Running.
She told us that the other day. We're shocked. We're like, oh, wow, good for you.
She's doing great.
She is doing amazing. Yeah. She actually beat me on that. I said, well, I'm jealous because you ran 1.5 miles. I ran a mile on the treadmill the other day, just as a warm-up kind of thing. But she did more than I did. So that's awesome. So we're going to show you a couple of her numbers, which were really amazing. So first of all, let's take a look at this one. Now, what we're going to show you is the result that you will get. If you do our program, you'll get a report just like this. It's what, Jody, 40 pages or something like this?
The COVID biomarker is about 40 pages, and if you get the test that does not include the COVID biomarkers, it's about 6, 7, 8 pages.
But
so
still a lot of info.
So much information.
Yeah, so and it's really great because Dr. Lewis explains things like we explain things. That's why we get along so well, because he explains things at a layman's level. He wants you to get it. He wants you to understand. And so he uses a lot of analogies and metaphors and stuff, just like we do, right? So what he is doing here is he's sort of giving an easy way to read your levels. And so he gives sort of you've heard us talk about the chronic disease temperature. That's his patented thing. The CDT is what he calls it, chronic disease temperature. And sort of a temperature gauge, like does your health have a fever, or is it doing well? And so he uses that kind of for this test as well. What we're going to show you is a side by side of what this person did and how they improved. So take a look at this. So what you see on the left is what she did before, and what you do on the right is after. So she had a temperature, so to speak, of 101. Okay, well, you got a temperature of 101, you're sick, right? You want to bring it down.
Because anything over
98.6.
Yeah.
So nobody is 98.6 on this thing. Let's just say that right up front. I mean, you can be the healthiest person. The healthiest people are in the 99 range somewhere.
Yeah.
Now, keep in mind, this woman just went through cancer treatment, and she still is dealing with cancer. She's not out of the woods yet. So she had 101, and after our program, she shaved it down to 100.4. Now, that may not seem like a lot, but that is huge. That is a massive change.
Right.
And so look what she did. So the massive change, for the reason that I circled there. Insulin is a very good marker of how you are doing, because if your insulin is high, your body is continually fighting inflammation. Well, inflammation is the hallmark of every other disease. It starts with inflammation, no matter what it is. And so we look at this, and she had an insulin level of 10.2. Well, the ideal range is like below 6 at the very most. And so look what she cut it in half. She went down to 5.4 in just a few months. That is an amazing change. And so that is one marker that we really want to look at when we're looking at how healthy are you. So insulin, fibrinogen, this is another thing we want to look at. So fibrinogen is, well, you think of the word fiber. So the word fiber, like when you get a cut and you get a scab that covers over it, that's fibrinogen at work. It's knitting together fibers, if you will, of your body's tissues and repairing something. So if your fibrinogen is up, that means your body is repairing something. Okay, so if you have fibrinogen is up and insulin is up, that means, okay, well, inflammation's up and your body is coming together to try and fix it. So there's something wrong. So that's clue number one. This is sort of like detective work when you look at your blood test, trying to figure out what's going on.
Right.
So we looked at that, and so obviously she had some inflammation going on.
Right.
And so we attacked it from that point. Okay, she's got some inflammation. Let's see what else she had going on. So in the second one here, we can tell, again, these are before and afters on the left and the right of each of these two columns. So keep that in mind. Okay, so take a look at this. So your EGFR, top left there, She was at 76 and 87. What are those numbers? Okay, so those numbers tell you how well your kidneys are working.
All right.
And she was in the yellow. She was not in the green. In the green means you're doing well. She was in the yellow. She wasn't doing so hot. So she goes through our program, and look at that. She ends up in the green. She ends up in the green. So basically, this woman who has cancer actually improved her kidney function just doing some dietary and some lifestyle changes.
Yeah.
That was it. And look at that. She made some massive changes and got up into the green. Now, go down a little bit lower than that on that same column on the left there. Vitamin D, the other thing that's circled. So a vitamin D level of 66, she was doing okay. I mean, Dr. Lewis considers anything over 50 or 60, I think, okay. I prefer 80 to 100 personally. Well, look at that. She jacked it right up to 88.
Yes.
Now she's in good range for almost anything that comes at her because vitamin D is extremely important for your immune system, especially when it comes to COVID.
Right.
I mean, it just is. I mean, you look at the test studies that are done around the world, and those who have the highest vitamin D levels have the best outcomes.
Right.
It's just what it is. And so, whether you have the jab or you don't have the jab, I mean, I'm telling everybody now, you know what, guys, if you're keeping your eyes open and you're looking at the news, it doesn't matter one way or the other. What matters is how are you taking care of yourself at the time that this thing comes at you? That's going to determine your outcome. And of course, everybody wants to have a good outcome. So the first thing to do with that is take vitamin D.
Right.
And bump it up like this woman did, up to 88. Now, let's go to the right-hand side. So let's look at neutrophils. What is a neutrophil? So a neutrophil is one of the white blood cells. Thank you. And so you got neutrophils, lymphocytes, monocytes, eosinophils, and basophils, as you can see them kind of going down the right-hand column there. So neutrophils, if neutrophils are above the normal range, that tells us that there is a bacterial infection in the body somewhere. So that's how you can tell if someone has a bacterial infection. Now, if someone has a bacterial infection, quite often, you know what the primary cause is?
What?
A root canal. Because, well, we'll explain a little bit later why, but root canals are, they're notorious for leaking, well, I'll just tell you right now, I don't have to keep you in suspense. Root canals are notorious for leaking toxins into the body because when they take everything out of the tooth, what they do is they drill everything out. That's why it's a root canal. They go way down deep and they clear everything out. And it's kind of like when they go in and get cancer. They go try and grab all the tumor and say, we got it all. You never get it all. You know why you don't get it all? You may get rid of the tumor and get rid of the stress, the initial stress on the body, but if you don't change anything about your diet and lifestyle and how you're living and your environmental toxins and all that, the cancer is going to come back because cancer is systemic. If there's something that's going on around you or in you that's causing it, and just to take out the tumor is not the final answer. It does reduce the stress on the body so the body can catch up a little bit. Sometimes that's enough for quite a long time, if not for a lifetime for most people. But you have to understand that cancer is systemic, and what it will do is it will lodge itself into the weakest link in your body. So if you have an overused part of your body, you'll notice that's where the cancer will rest. The grandmother I never met because she passed away before I was born. My dad told me about her. She was curling. You know that sport where you throw the rock down the ice, and they do it a lot in Canada and a lot
the Canadians listening will know.
Yeah, and European countries. So she was curling, and she fell really hard on her hip. Didn't think anything of it, bruised, whatever. Well, lo and behold, I don't know how long it was afterward, she developed cancer, guess where?
Yeah.
In her hip. Not because of anything else that happened in her life, just because she had trauma in that area of her body that never, I guess, really healed properly. And that's where the cancer attacked, because that was the weakest link, and that's where it set up residence in her hip.
I'll tell you what, in Canada, that story is much more common than you would even know. My mom is heavily involved in curling still to this day. And she knows of that story over and over again.
Oh, with people getting cancer?
Absolutely.
Really? Wow, I didn't know that.
Falling on the ice, absolutely.
Well, and you know, some folks, it's a really sad thing, but the folks that are brilliant, that really are just geniuses, sometimes those folks will get brain cancer.
Well,
it's like, what?
And that makes me think of, and this is totally off the topic, but that makes me think of radio DJs.
Yep. Yep, a lot of people who do vocal work for a living, singers, that kind of thing. Now, not to say that every DJ and every singer is going to get throat cancer, but if you're not living a healthy lifestyle, you are creating a weak link by that part of your body that is used a lot. So you got to take care of yourself no matter who you are.
And maybe the EMFs.
Yeah, the EMFs. Yeah, the EMFs from the microphones and things and all the equipment.
I know somebody personally.
Yep, all kinds of crazy stuff like that. So anyway, this person was. So anyway, where was I? Oh yeah, we're talking about root canals. Boy, did we get off track there. Okay, so a root canal basically takes out everything just like they take out a tumor, but so the problem is not really solved, because what happens is you end up with a dead tooth. If you take out all the life-giving force to that tooth, which is what they're doing with a root canal, you end up with a dead tooth. I liken it to, I remember the movie Weekend at Bernie's. It's like carrying around Bernie to all these places, and he's dead, but they're still carrying him all around. So that's what this dead tooth is like Bernie in your mouth. And it's not doing anything. So dead things, they're not very beneficial, are they? What happens to dead things? They decay, they cause disease. You don't want to be touching dead things. We hear about all that in the Bible. You're not supposed to touch dead things, right? That was the instructions to the Israelites. If they touched a dead thing, they were unclean for the day, right? So when you've got a dead thing in your mouth like that, and they pack it full of stuff so that nothing gets in there, and they cap it off and they go, okay, it's all good. It's not all good. Because there's miles and miles of tubes in your teeth that you don't see in any biological dentist, like our good friend Dr. Thomas Lokensgaard could tell you, out of Brentwood, Tennessee, by the way. Go see him if you can. He's excellent. Anyway, he'll tell you that they'll never get all the bacteria out of there. So what happens is you cap off this bacteria, and now you've got this sinister thing living down there, continually dripping bacteria into your bloodstream, unbeknownst to you. It's not going to hurt. There's going to be no abscess. You'll never know until you do a blood test like this, and a smart doctor will say, your neutrophils are up. Do you have any root canals? This is why we ask you if you have any root canals. That's one of the first things we do when you start a Biologic Blueprint program. We have all kinds of big questions, and that's one of them. One of them is, have you ever had any root canals? Have you ever done this? Have you ever done that? That's why, because we combine those questions and your answers with your blood tests, and we also get you to do a 3-day food log. We combine all this info, and pretty soon the little detective work becomes pretty obvious,
right,
who the culprit is. So we can solve the mystery, as it were, like Scooby-Doo.
And even then, you might be freaking people out by saying, oh my goodness, it's my root canal, I got to get it pulled, and what if it's right in the front?
And sometimes it's not, though. Sometimes it's not.
But there are also different treatments nowadays that you can get done from biologic dentists, like our friend
ozone.
Dr. Lokensgaard. Yeah. So many different things that you can get done and different protocol, and it's amazing.
Yeah, you don't necessarily have to take the tooth out, but you do have to do something to it, because it is the source of the problem, and you have to attack that problem somehow.
And even then, like, I don't have any root canals, but I do have this one tooth, a wisdom tooth, that is never...
Oh, it's been capped several times.
It's been filled probably 8 times in my life.
Yep.
I'm pretty sure it's I've got some issues that I haven't overcome yet. I wonder if that, has anything to do with it, and I'm getting that worked on, and we'll see.
Yeah.
Yeah.
Now, here's another interesting thing. Take a look at the bottom right there. EOS percentage. You see that one there? So a 9 to a 3, wow, that looks pretty drastic. And it was, because you can see on the far right-hand side, there's a dark green patch that says 6 on there. That means she did really well. She's like, they really improved. The dark green means you really improved on something. So what's an EOS percentage? That means eosinophils. It's another one of those 5 white blood cells. And what that one detects is parasites. So she had a parasite. That's what it was. So we got rid of that with, guess what? Good old, you've heard it a million times on the alternative news sources, ivermectin. Ivermectin is great for getting rid of parasites. That's what it's intended for. Never mind other things. In humans, go figure. Yeah, so it's been used in other countries for many, 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 many years, for like 40 years. So that's what we did.
Nobel Prize.
For humans. For humans, that's right. So she took ivermectin, and look at that. She got rid of the parasite, and we have proof right here on her blood test of before and after. How about that? So that's another great thing we can tell, whether you have a parasite. And sometimes a parasite is responsible for your not absorbing nutrients.
Okay.
Yeah.
I didn't know that.
Yeah. That's another thing that will happen. Now, here is another interesting thing I want to show you. So this one test on the far right here called D-dimer, the first one that's circled there in red. D-dimer, if you're testing for blood thickness and you're concerned about spike proteins and that kind of thing, this will be a common term that you will hear. So D-dimer determines the thickness in your blood, and I won't get into specifics, but anyway, it has to do with the thickness of your blood and how well it's moving and how much it's repairing and that type of thing. Another thing that will determine that is fibrinogen activity. You heard us talk about fibrinogen already, where your body's putting fibers together. Now, here's a little trick. So if both D-dimer are elevated, or D-dimer and fibrinogen are both elevated, that just means that your body's working on something. That's a normal clotting behavior. Now, if D-dimer is up, but fibrinogen is normal and low, that means spike proteins are at work.
Ah.
Yeah, so interesting. So here, with this person, she had elevated D-dimer.
This is a different
This
person.
is a different person now, yeah. So this person had elevated D-dimer and elevated fibrinogen. So all that meant is that there was something going on in her body that her body was repairing. She did not have spike protein activity. So that was interesting to see because she was very concerned. She saw that her D-dimer was up because these results come to you before they come to us. And if you want to take a look, you can. And so she looked at them and she became concerned. And she said, oh my D-dimer's up. That means I've got spike protein activity. Well, not necessarily. And that's where we come in and we can help you read these things and discover some of these interesting parameters. So that is another interesting thing. So let us go back to here. Okay, so another way to tell if you're not getting micronutrients is if your ESR is up. So that's your SED rate. Let me just show you this. Okay, so let's move it over here. So your ESR, your erythrocyte sedimentation rates. What is an erythrocyte? An erythrocyte is a fancy name for a red blood cell.
Okay.
So the sedimentation rate is the rate at which these will sink in a test tube. And they shouldn't be sinking at all. But the rate at which they sink per hour or per inch will give you this number. Down on the right there, sedimentation rate of 18. It should be less than 3. So if your sedimentation rate is high, that means your body is not getting the nutrients it needs. So, because think of it this way. So let's say that your red blood cells are like drones, like in these remote control drones that people
Right.
fly around, right? So you've seen the animation of blood flowing through a blood vessel.
Yep.
And these little hockey pucks are kind of going through the blood vessel, and that's your red blood cells, right? That's the little animation they always use. So they need power in order to fly, just like a drone. If they don't have any power, they come down to the ground. So what powers a drone? Batteries. What's your batteries? Your batteries, your body's electric, right? So the same thing that powers a battery in the world of electronics is the same thing that powers you, minerals. They need minerals in the water to create a charge. So basically, what does that mean? If your erythrocyte sedimentation rate is high, in other words, the little drones are coming crashing down because they don't have any energy, it's because your body's not absorbing minerals. Just like a battery needs minerals in the water to charge, right? So that's what we're telling with the ESR rate, that your body's not absorbing minerals. So let's go back to that illustration for a second. So if the ESR, or the sedimentation rate, is high, that means your body's not absorbing minerals. The next thing below it may tell us why. H. pylori. What's an H. pylori? H. pylori is that parasite we talked about.
One of them.
One of them, yeah, it's a parasite, but so H. pylori is a parasite that we need to get rid of because H. pylori is a natural antacid. So let's put 2 and 2 together here. If H. pylori is creating an antacid in your stomach, and your stomach needs acid to digest food, it's not going to digest the food properly, right?
Right.
So if it doesn't digest the food properly, are you going to be absorbing minerals? No. If you're not absorbing minerals, are your little hockey pucks, your red blood cells, going to have enough electrical charge, enough energy? No. Why? Because they don't have enough minerals. And that's why your sedimentation rate is high.
Right.
So now we know that, okay, the issue this person is having is that they have a parasite that's creating artificial antacid, not allowing their body to break down foods. And they're not absorbing minerals. And that's why they're not absorbing minerals. You see, all you have to do is sort of backtrack and you can figure out what's going on if you combine the right blood markers. And that's what this test does. You wouldn't know to combine an H. pylori test with a sedimentation rate and come up with that, would you? I wouldn't. That's why Dr. Lewis put it together. And that's what's so great about these blood markers. They tell you these things and you can put 2 and 2 together, and lo and behold, wow, you can really figure out some incredible stuff about your health. All right, so we're going to come back and tell you about our program in just a few seconds. But we've never done this before. We have a commercial.
What?
You want to see our commercial? Okay. All right, here comes our commercial. We'll be right back after our commercial, right after this.
Hey guys, Scott Laird.
And Jody Laird.
And do you have your free ebook yet? If not, why not? All you have to do is go to lairdwellness.com/blueprint. Talk to me for half an hour about our Blueprint program, our Biologic Blueprint Wellness program. You can choose 6 weeks, 12 weeks, whatever you want. We can talk more about that. But at the end of that call, I'll give you a free copy of my Growing Concern book all about GMOs. You really need to know this stuff. And we have 3 people signed up for the program already. They're doing it right now, and you can join them. We only have room for 7 more. So whether you want to do the 12-week program or the all-new 6-week program, each one has their benefits. Whether you want more coaching through the 12-week program or 6 weeks just to get started and you got this and you can take care of it yourself, great, we can do that too. And we can tell you all about it at lairdwellness.com/blueprint. And Jody, you don't even need to start right now if you don't want to.
No, this is probably the worst time of the year to start because, I mean, we're celebrating Hanukkah. Everybody else we know is celebrating something, Christmas, whatever it is. We're probably eating too much. So don't start now, but you could probably start next month, have a fresh, clean slate, and we'll help you through it.
Yep, but you need to sign up now because you don't want to lose your spot. Like we said, we only got 7 spots left. So if you want one of those spots, if you want to start now, or if you want to start after the holidays, that's up to you, but make sure you get that call in now, okay? So go to lairdwellness.com/blueprint, choose the time for your consultation, free 30-minute consultation with me, and like we said, you'll get a free ebook at the end of it, my book called Growing Concern, all about GMOs. So go there now, lairdwellness.com/blueprint.
All right, there you go. There's a commercial. So anyway, so we're going to talk to you more about that. So yeah, you can get a free ebook right now. If you don't even have to sign up for the program. I'll give you the free ebook after you call, and all you have to do is go to lairdwellness.com/blueprint, which we should show you the information. There it is right there. You go there, you book a time with me. I'll talk to you for half an hour about this whole thing, give you all the information you need to know. So you make a decision. And after that, I'll send you a PDF of my book, Growing Concern. This is a book I wrote several years ago about the danger of GMOs. And guess what? It's almost prophecy because it's happening now.
Yes.
So, and it was a really great thing. I talked to a farmer. He was the first farmer to beat Monsanto in court.
Yep.
His name is Percy Schmeiser. He was from Saskatchewan. He
From
died.
our home province, my home province.
He died like a year or two ago.
Yeah.
So anyway, but yeah, he was the first guy to beat Monsanto, and it wasn't over millions of dollars. It was over $600. He lost to them for all these other cases, but then he won for over $600. It was hilarious. Anyway, but he was the first one to really raise awareness of what's going on, because in many farming communities, GMOs are the thing, and they don't care what you think about it. But anyway, so our Laird Wellness Blueprint program, I can't even speak, is either 12 or 6 weeks now. Here's what's included in the 12-week program. So you get an initial blood test like we talked about. All the things we talked about tonight, you will get that. And you also get a 60-minute consultation. You can have that with me or Dr. Lewis or both of us. It's a 30-minute consult every 10 days with Jody and me after that, so we can coach you through how to reverse or correct the things that we see that are going on in your blood, and you can turn your health around like the people we showed you tonight with their results. You'll also get 6 educational videos in between the times that we talk to you every 10 days. You'll get a cool bioimpedance scanning scale. This tells you your not only your weight, but your muscle content, your fat content, your hydration, all kinds of cool stuff. We'll also give you some blood testing equipment so you can keep track of your ketones and your glucose and all that kind of good stuff. We'll give you $100 credit for our store, because inevitably you're going to have to get something to help supplement what you're doing. We'll also get you into a HIPAA compliant patient portal where you can put all your information. It's all in one spot. You'll get unlimited tech support from me and Jody. We'll get a part of a private Facebook group, and you'll get a follow-up blood test after it's all done, and another 60-minute consult to see how you did, so you can compare your numbers just like the folks we did tonight. And if you tell anybody about us, we'll say, hey, thanks very much for sending someone our way. If they sign up, you get 20% net referral fee. How about that?
How about
And
that?
we've handed out several of those checks already. People are taking advantage of that, and they are very happy to oblige, of course.
Yes.
So now the Biologic Blueprint Express is our 6-week program. Very similar, but there's only one blood test, because at the end of 6 weeks, you can't really tell whether something has improved or not. You kind of need that 12-week that 12-week distance. But anyway, you'll get the initial blood test. This is for people who just want a kickstart, and after 6 weeks, they figure they can do it themselves. Yep, no problem. You'll still get the 6 educational videos. You'll meet with me and Jody every 7 days, so you get more often meetings with us. So you'll get 6 meetings over the 6 weeks. You'll still get the scanning equipment, still get the blood testing equipment. Instead of $100 credit, you'll get 20% off anything you want for the full 6 weeks. You'll also get into the patient portal, the private Facebook group, the net referral fee, and the best part of it is it's 35% less than the original program. So there you go. Those are your options for the Biologic Blueprint program. We really hope you take us up on it. We have 3 people involved right now. There are only 7 spots left, just like the commercial said. And so I just spoke to someone before we went on tonight, and I think they're going to sign up as well, maybe a couple of people in their family. So you want to get in on this. We only take 10 people at a time because we don't want to do a whole bunch of folks, because we're not able to service everyone appropriately and really get to the root of what you're dealing with, because we really want to help you. We really want to get to the root of your issues and to correct them. And sometimes you've just tried everything. You don't know what that is. That's why we have the Biologic Blueprint program. It's Biologic Blueprint. It's very specific behind the name. Bio, your body. Logic, we speak logically. That's why I called it the Biologic Blueprint program. And the blueprint is that everybody's different. We will tailor to what you are struggling with and what you need to get through. So go to lairdwellness.com/blueprint, book your free consult, get your free book, and we'll see you soon. And we really hope you take us up on it. So until then, thank you for watching. We'll see you next time.
Take care.